Hey, the National Council on Skincare Prevention has declared today, which is the Friday before Memorial Day, Don't Friday. And here to explain what that means and how you can protect yourself against some of the deadly rays that the sun brings to us is Dr. Michael McPhee from Promedica Cancer Institute. Thank you so much for joining us this morning.
Thank you for inviting me.
It's a pleasure to have you here. John James has already told us Sunday 91 degrees, Monday 93, and the temperatures are rising, and we really need to be on the lookout to protect ourselves.
I agree with you. Yeah, the inclination is first day of summer, go out there and get your sunburn or suntan. We try to be an advocate for sun protection, skin cancer prevention by saying, hey, take the necessary precautions to help reduce your chances of getting skin cancer.
Okay.
So that means wide brim hats, SPF 15 or greater lotions, and apply it quite frequently.
Okay, and especially with a lot of the pools opening up too, what's a rule of thumb for applying sunscreen for the kiddos?
You got to be very careful on the instructions given on some of these suntan lotion products. They may not be accurate. We have some new legislation coming from the FDA that says come December, they have to be very clear whether this is water resistant or not. So the rule of thumb is apply it every 2 hours. So SPF 15 or greater, and apply it every 2 hours, because the water or sweat can take it off, and then you've been exposing yourself to the damages of UV ray if you don't reapply it frequently. So,
is there any race group in particular that is more prone to getting skin cancer?
That's a good question. You know, we try to counsel the patients and people who are fair-skinned that they're going to be the ones that are most vulnerable to the damages of UV radiation. But anybody can develop skin cancer because anybody has melanin, which is the source of malignant melanoma. So we tell patients it's an equal opportunity cancer. Anybody can get malignant melanoma.
Okay, what are some of the checks folks should be making just in case maybe they are suspicious of maybe they have?
Yeah, you'll look at your moles and you see if there's any change. So we go through the ABCDs with them. Any asymmetry, change in color, bleeding, if it increases in size, you have to make note of it and bring it to the attention of your doctor right away.
Okay, Doctor, I want to ask you too really quick about some of the labelings when it comes to sunscreen. Now that's going to change fairly soon.
It is going to change. I think the most important point for your viewers to know is that SPF 15 is probably the lowest one you want to go to, nothing lower than that. And it doesn't mean if you put an SPF 30 on that it's twice as much protection. It just means it lasts twice as long. So SPF 15, and apply it every 3 to 4 hours, and then make sure you look at the labeling. You want to see if it is truly waterproof, because if you go swimming, it can wash off.
And that was my next question. Some of the errors that folks may make before applying sunscreen, particularly when going into a swimming pool, you have to actually let it set on your skin for some time before you go in.
That's right. Maybe about 10 to 15 minutes to let it really get absorbed into the skin. Okay. And you can wear sun protection fabrics too. So if you don't want to apply it, you can wear shirts and clothing that actually has FPF built into it. So that's an alternative as well.
When we're talking about applying sunscreen, last question, we're talking about on our arms, on our legs, any type of body part that's being exposed to the sun. So that includes our face.
Absolutely.
And the back of our necks.
That's right. Okay. And the products you want to look at, they usually have some kind of zinc within it. That's the most important ingredient that you can find in those lotions.
Okay, again, thank you so much
for
joining us this morning. Hope to see you back soon to keep the health talk continuing on WNWO today. Again,
Thanks,
Dr. Michael McPhee from Promedica. Thank you again.
Appreciate it.
We will be right back after this break. 36 minutes past the hour. Stay tuned.